University Hospitals really views cancer care as one of their strengths. And we said we've got two marquee institutions here, University Hospital Seidman Cancer Center that's devoted to the care of adults facing a diagnosis of cancer, and Rainbow Babies and Children's, which has a long-standing tradition of being a major contributor to the Children's Oncology Group, our national cooperative group. Why don't we develop a collaborative model of care, get these two institutions to work together to serve the needs of this demographic that's kind of right in the middle. It's been a program that really was conceived in 2006. We're now almost 10 years into what we're doing. So our mission in the Angie Fowler Institute at University Hospitals, Rainbow Babies and Children's Hospital, is to deliver comprehensive care for children, adolescents, and young adults who are facing a diagnosis of cancer.
So while there's often a pediatric component to a cancer center, which is something that's designated by the NCI, the relationship between the pediatric and the adult side really varies between each hospital. And I think that the model that we've created here is something that I hope can be emulated in other centers across the country, because we really do need to focus on our AYA patients. We know that by focusing on this population, since about 2000, we've actually seen increases in their outcomes, and actually increases in their outcomes over that which we're seeing in our younger pediatric patients. And it's really just because we are focusing on the unique challenges of treating their cancers.
One of the things we really wanted to do was to create an environment that enhanced opportunities for communication and that gave the patient a chance to really control their environment. And so you walk into one of the clinic, we call them exam rooms, but they're a combination of exam room and treatment room. And it's a space that you can go into, and if you want to change the color to yellow or blue, you can do that. And, at some level you think, well, why does that matter? But I think the light in a space really changes the mood of a person going through it. 1 in 210 individuals between the ages of 15 and 30 will learn that they have a diagnosis of cancer annually. So getting primary care providers to appreciate that, to understand that it's something that should be on their radar when they have someone who has a problem, chronic pain, something that doesn't go away. Model of care is also another big part of the mission. How do we develop this collaborative approach that involves all of our providers in the Seidman Cancer Hospital and Rainbow? So what we said was, look, when a patient comes into our health system, regardless of who they see first, we want a team that's devoted to the care of teens and young adults to be identified. We want that team to coalesce around this patient, talk about their presentation, their diagnosis, and then together decide where should they receive their care.
The treatment of our relapsed or refractory cancers is truly unique. There are very few institutions across this country where you have a pediatric oncologist who sits on the adult phase 1 team, who's able to really leverage all of the studies that they have to our younger patients, or to their younger patients and our older patients. We know that for solid tumors, the median age of a lot of our trials is right around 17. So there's a whole bunch of patients we take care of who are over the age of 18, and they need access to trials. And if we put them on adult trials, we may start to see some signals of efficacy in our pediatric cancers by putting our older pediatric patients on adult trials. And that may help us really be able to figure out what agents we should be studying in our pediatric cancers.
So part of it was education, part of it was model of care, and then the other big piece of this is really the approach. Medically, what are we doing? If we more often see chromosomal abnormalities or mutations that are associated with a high-risk, poor prognosis phenotype in someone in their 20s, well, then we should be looking for that, and we should be modifying the delivery of care, the type of therapy that we use based on that understanding of the biology. University hospitals will be the first center in the entire state of Ohio to offer proton therapy. We're very fortunate to actually have that right on our campus. The second leading cause of cancer-related mortality in teens and young adults is brain tumors. So there's no question this is a hugely valuable therapeutic option for patients in that age group.
Another thing that we've focused on with that is, where are these patients being treated? Do they have access to clinical trials? There have been studies done that we know that patients who are treated by a pediatric oncologist are 7 times more likely to be put on a clinical trial compared to an adult. Being part of a clinical trial is part of our standard of care in pediatric oncology.
We're also one of the few centers in the country with FACT accreditation for complicated forms of stem cell therapy, bone marrow transplant, which is an important approach to the treatment of the most complicated and aggressive cancers that we see. Everything we are doing is preparing our patients for life after cancer. We want them to emerge from this experience being able to put it in their rearview mirror and to get right back into life to doing everything that they want to do.